akan diperlukan. Maksudnya saya kena dekat ke teman saya untuk aktif terus dekat analysis. The clinical evaluation, finding and management of a patient-based right distance and radius fracture. Fracture of the radius and ulna are the most common fracture of the upper extremity. It is the fracture occurring more often than proximal fracture. All fall onto a outstretched hand is the most common mechanism of injury for fracture of the radius and ulna. Radius and ulnar fracture, also known as adult bone forearm fracture, a common fracture of the forearm caused by either direct trauma or indirect trauma. Example, for injury, motor vehicle accident, soft crack. This initial imaging finding are negative and suspicion fracture remaining. They can repeat radiography in 7 to 14 days short deformance. Patient must be repeat X-ray after 40 days if she is complaining pain at the arm. Incomplete convergent fracture without cortical disruption, called buccal thorax fracture, are common in a child. In adult, distal radius fracture are the most common forearm fracture and are typically caused by a fall onto an outstretched hand. Epidemiology. High incidence, men between age 10 and 20 years, women over age 60 years. Cause of fracture, radius ulnar. Most common in motor vehicle accident. Industrial injury, clinical as assaulted, sport injury. Example, football, rugby, karate, because this sport use a hand. Sign and symptom of a fracture in the radius ulnar. First, pain. Fracture in the radius ulnar can cause significant pain at the site of the injury. The pain may worsen with movement or when pressure is applied to the affected area. Second is swelling. Fracture often results in swelling around the injury area. This swelling can be accompanied by bruising or discoloration. Number third, deformity. In some cases, a visible deformity or misalignment of the forearm may be present. This can be seen as an abnormal bend or angulation of the arm. Number four, limited range of motion. Fracture can restrict the normal movement of the forearm and wrist. You may experience difficulty in bending or straightening your arm, or have reduced mobility in the wrist. Number five, tenderness. The fracture area may be tender your touch, and you may feel localized pain when pressure is applied. Number six, numbness or tightening. In more severe cases, nerve damage may occur, leading sensation of numbness, tightening or weakness in the hand or fingers. Type of fracture radius. Number 5 is collis fracture. This is a fracture of the distal end of the radius, typically caused by a fall onto an outstretched hand and result in the wrist being bent backward. Second, mid fracture. This is the opposite of a collis fracture, where the distal end of a radius is fractured due to a fall onto a flexed wrist and result in the wrist being bent forward. Number third, button fracture. This is a fracture that occurs at the wrist joint, specifically at the articular surface of the radius. It can be caused by a direct blow or a fall onto a outstretched hand. Number 4, Galeazzi fracture. This is a fracture of the radius along with dislocation of the distal radial ulnar joint. It typically occurs due to a fall onto an outstretched hand with the forearm pronate, palm facing forward. Classification of fracture radius ulnar. Number first is location. Fracture can occur at different points along the radius of an ulna. For example, a fracture may be classified as a distal radius fracture if it occurs near the wrist joint, or a midshaft fracture if it happens in the middle of forearm. Number two, pattern. Fracture can have different patterns such as transverse, oblique, spiral, or comminuted. A transverse fracture occurs straight across the bone, while an oblique fracture has an angle break. Spiral fracture results from twisting force, and comminuted fracture involve multiple bone fragments. Number three is severity. Fracture can range from mild to severe depending on the extent of bone displacement or fragmentation. For distal, a non-displaced fracture means the bone remains aligned, while a displaced fracture involves a shift or spiration bone fragment. Okay, management in fracture radius. Okay, non-surgical treatment. This patient can use casting or splinting. For stable fracture, where the bones are not significantly displaced, a cast or, or splint may be applied to immobilize the forearm and allow the bones to heal. The cast or splint helps to keep the bone in proper alignment during the healing process. Number two, close reduction. In some cases, a healthcare professional may perform a close reduction, which involves manipulating the bones back into the proper position without the need for surgery. Example, CMR. To do CMR reduction, if patient not complain the pain lah. After reduction, a cast sendiri certificate applied to maintain alignment. Number three, functional bracing. Certain types of fracture, such as stable fracture near the wrist joint, may be treated with functional bracing. This involves using a removable brace that allows for limited movement of the forearm, while still providing support and protection. Number four, physical therapy. Once the initial immobilization period is over, physical therapy may be recommended to help restore strength, range of motion, and function to the forearm. Surgical treatment. If non-surgical treatment fails, patient to do surgical treatment for the fracture radius. First is ORIF, or open reduction and internal fixation. This procedure involves making an incision to directly access the fracture bones. The bones are then realigned, reduced into the proper position, and held together with internal fixation device such as a plate, screw, or rod. This method provides stability and allows for proper healing. External fixation. In some cases, an external fixation device may be used to stabilize the fracture bone. This involves placing pins or screws into the bone on either side of the fracture and connecting them with an external frame. This method is often used for fracture with significant or soft tissue damage, or when other surgical options are not feasible. Number three, intramedullary nailing. This technique involves inserting a metal rod nail into medullary canal of the bone to stabilize the fracture. It is commonly used for fracture that occur in the shaft of the radius or ulnar fracture. Presentation case. Okay. This patient coming to emergency and trauma department of Sultanah Aminah JB. Name of the patient Muhammad Faizal bin Muhammad Fazil from Johor Bahru. Age 38 years. Male, Malay, Islam. This diagnosed fracture based on right distal and radius fracture. Patient knows not any past medical history or any allergic history. Okay, assessment finding. When the patient coming to emergency and trauma department, Mr. Faizal present laceration wound over forehead and pain over right hand. This motorcycle he was riding was involved with a car. As a pre-hospital care team, we conduct of a throat assessment to determine the extent of his injury. A comprehensive assessment was carried out to see signs of fracture such as swelling, pain, numbness, difficulty moving, the rise disability. In condition to this, the assessment of vital signs also carried out and found to be stable. No sign abnormality we found. The Glasgow Coma Scale assessment also is normal. Patient no complaint, head injury. Thankfully, Mr. Mcpherson was stable with clear air entry, no SOB, no significant bleeding or no tenderness over the chest and abdomen. Observation, blood pressure is 158/78, pulse 70, respiration 20, temperature 37. SPO is 98 under room air. Patient not use any support of the oxygen. Okay, emergency treatment and management on site. First respondent of a MVA case, the hospital team begin to act with direct and effectively measure to ensure the patient safety and stabilize during transport. As an officer on the front line in ensuring that the victim involved in a MVA case, patient must be stable condition while being transported by ambulance. What a patient worry out is that his complaint pain in his right, and there are possibility of a fracture in the radius or ulna. Initially, management include effective pain management intervention to treat the injury. Preliminary survey and patient assessment. After ensuring that the accident area is safe, we carry out a comprehensive assessment to ensure that there are no serious injuries to the victim. Those that require immediate treatment and intention. Since the victim complained of a laceration over the forehead, we performed a Glasgow Coma scale on the victim, and it was found there are no head injury. In addition, on airway breathing circulation examination to ensure there are no other potential symptoms. The patient also complained to pain his right wrist and found there was a possible fracture in his radius or ulna. We put a splint on his right hand to support the broken area and reduce movement in that area. Examination of the finger is done to ensure that the blood circulation runs smoothly. There are no signs of numbness, no 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 injury at the nerve. Emergency intervention. A fracture on the radius ulna is serious injury which require immediately medical attention at an accident and emergency department. To help with your pain and reduce and control any swelling, patient we apply at the ice apply the ice to the rice. Ideally, this should be to form the crushed ice wrap in a moist towel or cloth applied for up to 20 minutes. At the accident emergency department, they can diagnose the injury and the extent damage. They may require to use an X-ray to view the bone. For this, they can provide you with a determination how long the injury is expected to take heal and determine the appropriate treatment. This will involve applying an arm cast and sling or surgery to put the bone back in their original position. Pain management. The patient was given 0.5 millimeter anti-tetanus or ATT injection to prevent tetanus infection, ensuring the patient comfort was top priority. So we provide pain relief measure such as opiate or NSAID to ease their discomfort. Pain relief is an important part of hospital care and is usually given after primary survey has been complete. If patient come to emergency with a broken arm, leg or joint fracture, he or she should be offered pain medication within 60 minutes to their arrival. This medicine is prescribed to treat the patient and is given to reduce the pain level. Before give the medication, we ask the patient if any allergic to certain medication. Management in pre-hospital care. The patient was then sent to the department for an X-ray examination to see if there was a fracture in the radius ulnar. After that, it was found to be base right distal and radius fracture. The patient was then referred to the orthopedic department for further management. The orthopedic medical officer reviewed this patient. This patient suggests to do procedure CMR, close, close manipulation reduction with plaster of Paris or POP. This procedure do by the assistant medical officer on call from the orthopedic department, supervised by MO in emergency and trauma department. The main indication for this POP application to immobilize member or joint, ensure that the parts not moving, that have suffered a fracture in addition to being used a treatment for documented problem. CMR procedure of NPOP applied. Before the CMR to do, the patient has been given an explanation regarding the procedure performed and the purpose and complication that may occur. In addition, selection medication was given and the patient was given and explained about the purpose of the medication and side effect of the medication. This medication given is IV fentanyl, Ibuprofen 50 microgram and IV propofol 1 milligram. Among the side effects are hypotension, respiratory depression, desaturation. Patient understand the side effect of this medication. Before the procedure performed, the patient was signed a consent to allow the CMR procedure to be performed. This patient was fitted with a plaster of Paris POP to reduce movement on this hand. This patient also, after POP patient applied, we give a health education of POP education to care. If after a patient must come into the hospital immediately if any complication of the plaster POP applied. Example, POP is cracked, broken or wet. If patient still pain with POP or patient complain numbness at the joint after POP applied. If it has this symptom, patient must come in immediately to emergency and trauma department for reopen plaster of Paris. Conclusion. In conclusion, with the presence of this hospital care is very effective in treating cases such as a broken bones of any limb in a timely and efficient manner, in providing effective rehabilitation to patients and also reducing any complications. The assessment that can be done in lower limb injury including an examination of deformity, swelling, tenderness, neurovascular status, and compartment syndrome. Moreover, a thorough evaluation and assessment of the injury in primary survey in hospital care are important so that the healthcare provider can give the best treatment and management for the patient in a need of time. In Muhammad Faisal case, he was fortunate to have received an early response and a good cooperation from the pre-hospital care team in managing his broken after being involved in a motorcycle and car accident. Moreover, immediate action and effective communication among hospital care team and hospital team has ensured patient stabilization and setting the smooth transfer for Muhammad Faisal to the medical facility for hospital care and treatment. Thank you.